So the retina is the inside layer of the eye. It's the part of the eye that's most important for transmitting light into vision. So how does diabetes affect that? Well, diabetes affects essentially blood vessels in the eye and in the rest of the body. And it affects blood vessels in essentially two ways. One way is it causes blood vessels to close down. And blood vessels normally carry blood to various parts of the body. And when the blood vessels close down, the eye, as the rest of the body, responds to that by creating new blood vessels. And new blood vessels in the majority of the body are a good thing in that circumstance, but in the eye they are not such a good thing, because those new blood vessels are friable and more likely to bleed, and the eye needs clarity in the middle to allow light to transmit to it. The second way that it affects blood vessels is it causes blood vessels to leak, and leaking from the blood vessels can damage the retina, which is, as I mentioned, the inside part of the eye that's responsible for transmitting light into vision. And if you get leakage in that area, particularly the central part of the retina, that can significantly affect vision. So diabetic retinopathy can be a very, very slow-moving, insidious condition. Because it develops and progresses so slowly, and the changes that might occur in diabetic retinopathy occur over a long period of time, there may be no symptoms at all. Certainly diabetic retinopathy, as the disease gets worse, can eventually lead to poorer vision. However, in the majority of cases with diabetic retinopathy, there are usually no symptoms that the patient may perceive, certainly in the earlier stages of the disease. As the disease gets worse, the symptoms and the diabetic retinopathy gets worse, the patient may actually lose vision in that eye, sometimes irreversibly. But because for the majority of the disease process, the patient may not have any symptoms or any affected vision, patients may be unaware of the fact that they have diabetic retinopathy, and is therefore very important that they get seen regularly by an eye specialist to monitor their disease process in the eye. So diabetes most of the time causes very little symptoms for the patient until the disease progresses unchecked for some period of time. The blood vessels that are affected primarily by diabetes can shut down or they can leak. If they shut down, how the body responds to that is by creating new blood vessels to carry blood to the areas that are affected by the shut down blood vessels. In the rest of the body, that is a useful thing, but in the eye, which depends on the eye being clear, these new blood vessels can bleed. So if I show you the model of the eye here, here's the front of the eye, and here's the back of the eye. And if I take it apart, inside the eye we have a clear gel called vitreous, and it has to be clear so that light can go through it and hit the retina, which is like the camera film which allows images to be captured. These new blood vessels that can grow in diabetes, if they bleed into this clear structure. If you imagine then a fish bowl that is normally clear with a drop of ink in it or a drop of blood in it, you can imagine that the clarity of that fluid is affected, and that will significantly affect light being transmitted onto the retina, and that will therefore cause vision to be blurred. The second way that blurred vision can occur is because of blood vessels becoming leaky. So this is another way that diabetes can affect the eye and the body. When blood vessels leak their contents, that fluid will make the retina, where most of the blood vessels are, less functional. So the retina is the inside layer of the eye here. Which transmits that light into sight. And if there's leakage at the central part of the retina, which is called the macula, that macula doesn't work as well, and therefore will lead to the vision being blurred and affected. So one of the major problems with diabetic retinopathy is it usually causes no symptoms until the disease is very far progressed. In the United Kingdom, anyone diagnosed with diabetes will be enrolled and offered annual screening of their retinas with photographs. If the photographers or those people assessing the photographs have concerns about the appearance of the retina, they would refer that patient to an ophthalmologist with a specialist interest in diabetic retinopathy. So if you have screening and the photographers are concerned, you should see an ophthalmologist with a specialist interest in diabetic retinopathy. However, if you are concerned by your vision in between those screening tests, particularly if you're diabetic, you should see an eye care specialist. In particular, you should see an ophthalmologist who has a specialist interest in diabetic retinopathy, because blurred vision may well be caused by problems of diabetes in the retina, which can potentially be treated by a specialist with an interest in diabetic retinopathy. So diabetic retinopathy can have a myriad and a wide spectrum of features, and depending on those features, different treatments can be offered. So if the diabetic retinopathy is primarily new blood vessels that are growing in the retina in response to the diabetes, this needs to be dealt with by laser. So the cause of the new blood vessels growing in the eye is usually due to the blood vessels in the retina closing down, and this leads to factors being released which cause new blood vessels to grow, and these, as mentioned previously, can be friable and bleed. So what we do is we apply laser to parts of the retina to reduce or dampen down the drive, the eye's own drive, to create these new blood vessels. That laser is usually done on a machine like this, a slit lamp machine, or with you lying down on a bed. It can take 2 or 3 sessions to apply the laser, and it can be a little bit uncomfortable. But after that, it usually requires no further treatment. And the aim of that laser is to reduce the eye's drive to create those new blood vessels. So that's the response, that's our treatment for that type of diabetic retinopathy. However, the other aspect of diabetic retinopathy can be due to the leakage of blood vessels in the macula. The macula is the central part of the retina that's important for detailed vision. And if the blood vessels leak, in particular the macula, this can affect your vision significantly. The old treatment for that used to be a different type of laser, but this is rarely done now. The mainstay of treatment now for diabetic leakage in the macula, also known as diabetic macular edema, is injections into the eye to reduce the drivers that cause the leakage of the blood vessels in this area. Very rarely we may alternatively advise on some gentle laser in that area, but this is becoming less and less common. Now, the injections in the eye can sound horrific, but we do many thousands of these per year, and they're never quite as horrific as people anticipate. This involves lying on a bed and a few drops being placed on the eye to numb the eye, some cleaning fluid around the eye, and a little clip in the eyelids to keep them open, and the injection takes no more than 5 or 6 seconds. And most people say this is not as horrific as they had initially anticipated. You may need a number of injections over a couple of years to completely dampen down the edema or the swelling in the macula. Diabetic retinopathy at the moment cannot be necessarily cured. What one would hope is that with regular screening of your retinas, if you are diabetic, any early changes can be picked up earlier, and any potential treatment can be given to mitigate or slow down the progression of the diabetic retinopathy. Really, the best form of maintaining the retinas and the vision in the circumstance of diabetes is to be leading as healthy a diet as possible, a healthier lifestyle as possible, with a good diet and exercise. We know that controlling your blood sugar level and blood pressure level reduces the rate of progression of diabetic retinopathy. there's also some growing evidence that an active lifestyle, in addition to a healthy diet, potentially also slow down the progression of diabetic retinopathy. In the future, there may well be treatments that come along that potentially can stop diabetic retinopathy in its tracks, but at present, these aren't available. And really the best advice is to control the diabetes as best as possible in the blood sugar levels, in addition to the blood pressure and cholesterol, and leading an active life.